Praise be to Allah, the cherisher and sustainer of the worlds. I am Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic Substance Abuse Disorders and Smoking, under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: Addiction is the only prison where the locks are on the inside. Content outline: Number one, definition and forms of substance use disorders. Number two, health effects of drug addiction. Number three, health benefits of quitting addiction. Number four, second and third hand smoking. Five, tobacco use disorders, prevention and treatment, and recent advances in multiple choice questions. By the end of this presentation, the participants will be able to understand the definition and forms of substance use disorders and smoking, recognize the associated health risks and secondhand and third-hand smoke, appreciate strategies for preventing drug addiction and smoking, learn about various methods for quitting smoking and the importance of a combination of medication and counseling, and recognize the global recent advances in the context of substance use disorders and smoking. Drug abuse, according to the World Health Organization, and drug is defined as any substance taken by a human being that modifies one or more body functions, self-administration of a drug for non-medical reasons, resulting in functional impairments or social, physical, and emotional harm. Drug dependence, it is a state of interaction between a drug and a human body characterized by behavioral and other responses which include a compulsion to take the drug periodically or on a continuous basis in order to experience its psychic effects or avoid discomfort in its absence. Drug addiction, it is a state of periodic or chronic intoxication detrimental to the individual and society produced by repeated intake of habit-forming drugs. To call a person a drug addict, following criteria needs to be fulfilled. Number one is the psychological dependence, overpowering desire to take the drug and obtain it by any means to feel its pleasing effects. Number second is the physical dependence. When the drug is withdrawn, the person shows withdrawal symptoms such as irrational and violent behavior. Intolerance, the tendency to increase the dose of the drug over time to get a similar effect. Magnitude of the problem. In Pakistan, it is challenging to assess precise figures, but estimates suggest around 6 million drug users, with 50% being heroin addicts, and an increasing trend of intravenous drug use. Approximately 80% of drug addicts are reported. Concerning trend, brilliant and educated young individuals are increasingly becoming addicted to drugs. Global situation, according to BBC report, there is a rising prevalence of alcohol, marijuana, heroin, and intravenous drug use worldwide. Substance use disorders, SUDs. Substance use disorders are characterized by 11 criteria, including drug cravings, unsuccessful attempts to cut back, taking more of a substance than intended, and continued use despite negative consequences. The DSM-5 recognizes substance-related disorders resulting from the use of 10 separate classes of drugs. The 11 criteria outlined in the DSM-5 can be grouped into four primary categories, which is the physical dependence, risky use, social problems, and impaired control. So this is the classification of the psychoactive drugs, which includes depressants, hallucinogens, stimulants, opiates, and tetracannabinol. Symptoms of drug addiction. Psychological symptoms include mental health problems, irritable and agitated behavior, and paranoia and on-edge personality. The physical symptoms include headaches, weight changes, and disrupted sleep. And behavioral symptoms include secretive behavior, withdrawing from loved ones, and loss of interest in hobbies. Prevention and control of drug addiction. The primordial prevention includes addressing the root causes and risk factors, poverty alleviation programs, improving education and employment opportunities, promoting strong family and community bonds, and addressing mental health issues. The primary prevention includes educational approach, which is the public awareness campaigns on drug dangers, including drug prevention in school curricula and incorporating Islamic teachings against intoxicants, legislation and enforcement, strict penalties for drug cultivators, suppliers, and manufacturers, banning drug advertisements and glorification, and stringent border controls to curb drug trafficking. And the community involvement includes promoting healthy activities such as sports, recreation, and arranging anti-drug walks, seminars with community leaders. In psychiatry prevention, early identification of drug users and watching for the signs of loss of interest, appetite, weight, unsteady gait, red eyes, slurred speech, injection marks, mood swings, memory issues, academic decline, and drug paraphernalia. Detoxification and treatment, medically assisted gradual or quick withdrawal, medications for withdrawal symptoms management, and counseling and behavioral therapy. In tertiary prevention, relapse prevention and rehabilitation, change in social environment and removing triggers, continuous supervision and support system, vocational training and job placement assistance, counseling and psychotherapy, positive, highlighting the benefits of being drug free and negative risks and consequences of drug use. Preventive measures by the government and NGOs, strict regulation of drug plant cultivation, licensing and monitoring of legal cultivation of drug plants, for example, opium and poppy, eradication of illegal drug crop cultivation, anti-narcotics, mass media and awareness initiatives. Anti-Narcotics Force ANF headquarters in Islamabad runs awareness campaigns. NGOs like UNOCD and TNI work on drug prevention and awareness programs, combating smuggling and trafficking, strengthening border controls and interdiction efforts, and international cooperation to dismantle drug trafficking networks. Legislation and law enforcement, Control of Narcotic Substances Act 1997, strict penalties for drug offenses, ANF and law enforcement agencies empowered to curb drug trade, rehabilitation and treatment programs, dedicated drug treatment and rehabilitation centers, integration of mental health and addiction services in public health system, data collection and monitoring, periodic national surveys to assess drug use patterns and trends, collaboration with international agencies like UNOCD for data sharing, strengthening institutional capacity, enhancing resources and training for ANF and law enforcement agencies, increasing budget allocation for drug demand and supply reduction efforts. Now, coming to smoking, the act of inhaling and exhaling the smoke of burning tobacco or other substances, it is a major public health concern and indeed the leading preventable cause of disease and premature mortality worldwide. Tobacco use remains a persistent human-made epidemic. Epidemiology of smoking. While a remarkable diversity of tobacco products is emerging, combustible tobacco products are responsible for the vast majority of tobacco-related diseases and death. At current consumption rates, about 400 million adults worldwide will be killed by smoking between 2010 and 2050. Smoking causes or contributes to nearly all the major causes of deaths, including 16 different cancers, which is heart disease, coronary respiratory disease, cerebrovascular disease, diabetes, chronic liver disease, and kidney disease. Forms of smoking. Tobacco products exist on a risk continuum. Nearly all of today's tobacco products share an important unifying characteristic, which is the nicotine. Important differences between tobacco product classes lie in the mechanisms and modes by which nicotine is delivered to the user. Though an extremely addictive chemical, nicotine itself is not particularly dangerous. Rather, exposure to other tobacco byproducts, for example, tar, carbon monoxide, tobacco-specific nitrosamines, and heavy metals, are primarily responsible for tobacco-related diseases. Forms of smoking: combustible tobacco products, non-combustible tobacco products. So the tobacco product categories: combustible tobacco products include cigarettes, cigars, and hookah or water pipes. Cigarettes are the most popular form of tobacco consumption and the primary contributors to the global disease burden of tobacco use. Cigars, despite the users' belief that cigar smoking is less risky than cigarette smoking, cigar contains the same cancer-causing toxins such as cigarettes, often in higher volumes. Although the two products are equally hazardous from a chemical perspective, cigar smokers typically do not inhale and tend to use cigars less frequently, which may partially explain cigar users' low rates of heart and lung diseases. Hookah or water pipe, it is well documented that hookah carries health risks that are similar to or potentially worse than other forms of combusted tobacco. Non-combustible tobacco products include smokeless tobacco and electronic delivery nicotine system (ENDS). Smokeless tobacco. The main types of smokeless tobacco worldwide include chewing tobacco, moist snuff, and snus. For all smokeless tobacco products, nicotine is absorbed transdermally through the lining of the mouth. While mortality rates from smokeless tobacco use are not as high as combusted tobacco, smokeless tobacco contains high amounts of tobacco specific nitrosamine, which is a known carcinogen. Oral and esophageal cancers are especially common among regular smokeless tobacco users. Electronic nicotine delivery systems, known by a variety of terms including electronic cigarettes, e-cigarettes, and vape pens and vaporizers, medical and scientific experts are beginning to reach consensus that ENDs are generally less risky. Electronic nicotine delivery system studies on the efficacy of ENDs on smoking cessation have been mixed, but emerging evidence suggests that frequent ENDs use is associated with higher odds of quitting cigarettes. ENDs use is most prevalent among current smokers and smokers who have recently quit. Dangers of smoking, the health effects of smoking. Health effects include smokers and increased health risks. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing lung cancer by 25 times, and of women developing lung cancer by 25.7 times. Smoking causes diminished overall health, increased absenteeism from work, and increased healthcare utilization and cost. Smoking and cardiovascular diseases. Smokers are at greater risk for diseases that affect the heart and blood vessels. Even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. Smoking damages blood vessels and can make them thicken and grow narrower. This makes the heartbeat faster and the blood pressure to rise. A stroke occurs when a clot blocks the blood flow to part of the brain, or a blood vessel in or around the brain bursts. Smoking and respiratory diseases. Smoking can cause lung diseases by damaging the airways and the small air sacs alveoli found in the lungs. Lung diseases caused by smoking include COPD, which comprises emphysema and chronic bronchitis. Cigarette smoking causes most cases of lung cancer. If a person has asthma, tobacco smoke can trigger an attack or make an attack worse. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. Smoking and cancer. Smoking can cause cancer almost anywhere in the body, including bladder, blood, acute myeloid leukemia, cervix, colon and rectum, colorectal cancer, esophagus, kidney and ureter, and larynx. Liver, oropharynx, which includes parts of the throat, tongue, soft palate, and tonsils, pancreas, stomach, trachea, bronchus, and lung. Smoking also increases the risk of dying from cancer and other diseases in cancer patients and survivors. Smoking can cause cancer almost anywhere in the body, including esophagus, mouth and throat, voice box, lung, bronchus and trachea, acute myeloid leukemia, liver, stomach. Kidney and pelvis, pancreas, urinary bladder, uterine, cervix, and colon and rectum. Smoking and other health risks. Smoking harms nearly every organ of the body and affects a person's overall health. Smoking can make it harder for a woman to become pregnant. It can also affect the baby's health before and after birth. Smoking increases risks for preterm or early delivery, stillbirth, death of the baby before birth, low birth weight, sudden infant death syndrome, also known as SIDS or crib death, ectopic pregnancy, orofacial clefts in infants. Smoking can also affect men's sperm, which can reduce fertility and also increase risks for birth defects and miscarriages. Smoking can affect bone health. Women past childbearing years who smoke have weaker bones than women who never smoked. They are also at greater risk for broken bones. Smoking affects the health of the teeth and gums and can cause tooth loss. Smoking can increase the risk of cataracts, and it can also cause age-related macular degeneration, AMD. Smoking is a cause of type 2 diabetes mellitus and can make it harder to control. The risk of developing diabetes is 30 to 40% higher for active smokers than non-smokers. Smoking causes general adverse effects on the body, including inflammation and decreased immune function. It is also a cause of rheumatoid arthritis. Health benefits of quitting smoking. What happens when you quit smoking? Within 20 minutes, heart rate and blood pressure level returns to normal. And within 1 year, the risk of coronary heart disease is 50% lower than a smoker. Health benefits of quitting smoking. Quitting smoking is one of the most important actions people can take to improve their health. This is true regardless of their age and how long they have been smoking. Quitting smoking improves health status and enhances quality of life, reduces the risk of premature death, and can add as much as 10 years to the life expectancy, reduces the risk for many adverse health effects, including poor reproductive health outcomes, cardiovascular diseases, chronic obstructive pulmonary disease, and cancer. Benefits people already diagnosed with coronary heart disease or COPD. Benefits the health of pregnant women and their fetuses and babies, reduces the financial burden that smoking places on people who smoke, healthcare systems, and society. While quitting earlier in the life yields greater health benefits, quitting smoking is beneficial to health at any age. Even people who have smoked for many years or have smoked heavily will benefit from quitting. Quitting smoking is the single best way to protect family members, co workers, friends, and others from the health risks associated with breathing secondhand smoke. Benefits of quitting smoking according to the Center of Disease Prevention and Control. Within minutes, the heart rate drops. 24 hours, nicotine level in the blood drops to zero. In several days, carbon monoxide level in the blood drops to the level of someone who does not smoke. In 1 to 12 months, coughing and shortness of breath decreases. In 1 to 2 years, risk of heart attack drops sharply. In 3 to 6 years, added risk of coronary heart disease drops by half. In 5 to 10 years, added risk of cancers of the mouth, throat, and voice box drops by half, and risk of stroke decreases. In 10 years, added risk of lung cancer drops by half after 10 to 15 years. Risk of cancers of the bladder, esophagus, and kidney disease decreases. In 15 years, risk of coronary heart drops to close to that of someone who does not smoke. And in 20 years, risk of cancers of the mouth, throat, and voice box drops to close to that of someone who does not smoke. Risk of pancreatic cancer drops to close to that of someone who does not smoke, and added risk of cervical cancer drops by about half. Secondhand smoke. Secondhand smoking, also known as passive smoking on exposure to environmental tobacco smoke, is the inhalation of smoke from someone else's smoking. This can occur in indoor or outdoor settings where people are smoking, and it can include exposure to cigarette smoking, cigar smoke, and pipe smoke. Secondhand smoke contains more than 7,000 chemicals, including over 70 that can cause cancer. It is a major public health concern and can cause a range of health problems, including lung cancer, heart disease, and respiratory issues in both adults and children. The World Health Organization estimates that secondhand smoke causes about 600,000 premature deaths per year. There is no safe level of exposure to secondhand smoke, and even brief exposure can cause immediate harm. Third-hand smoke refers to the residual tobacco smoke contamination that remains on surfaces and in dust after smoking has occurred. This residue can include particles and gases, as well as toxic chemicals that can react with other chemicals in the environment to form carcinogens. Third-hand smoke can linger for days, weeks, or even months and can be a significant health risk for children, the elderly, and pets. Exposure to third-hand smoke can occur through skin contact, inhalation, or ingestion of contaminated surfaces or dust. It can also be a health concern for people living in homes or cars where smoking has occurred in the past. Examples of third-hand smoke risks include exposure to contaminated surfaces such as clothing, furniture, and carpets, exposure to contaminated air in indoor spaces, exposure to contaminated dust and soil. So this is from the Massachusetts General Hospital Research Institute, which defines first-hand smoke, the smoke that has been inhaled into the lungs directly from the source. The second-hand smoke is the smoke from burning tobacco that has been involuntarily inhaled, and the third-hand smoke, residual nicotine or and tobacco particles that accumulate on surfaces, furnitures, and clothing. So first hand is the active smoking, second hand is the passive smoking, and third hand is the leftover particles. Tobacco use disorder. Tobacco use disorder, also known as the nicotine dependence, is a chronic condition characterized by a strong desire to use tobacco products despite the negative consequences. It is a form of substance use disorder and is recognized as such in the Diagnostic and Statistical Manual of Mental Disorders (DSM-5). Symptoms of tobacco use disorder includes difficulty quitting or reducing the use, using more than intended, spending a lot of of time using a tobacco product, giving them important activities to use tobacco products, continued use despite physical or psychological problems caused or worsened by the use. It can lead to addiction and can have a negative impact on the overall health and well being. Nicotine, the main addictive ingredient in tobacco products, is responsible for the development of addiction. The addiction can manifest both physically and psychologically, making it difficult for individuals to quit smoking. So chemical compounds in the cigarette smoke, estimated number of chemical compounds in cigarette smoke are more than 7,000, and 70 number of these compounds with confirmed carcinogenic activity. Smoking prevention strategies and campaigns of World Health Organization. It includes Empower, World No Tobacco Day, Framework Convention on Tobacco Control and Research and Surveillance, the Tobacco Endgame, Eradicating a Worsening Epidemic. Empower provides a roadmap for the tobacco endgame. M is for monitoring tobacco use and prevention policies. P is for protecting people for tobacco smoke. O is for offering help to quit tobacco use. W, warning about the dangers of tobacco. E, enforcing bans on tobacco advertising, promotion, and sponsorship. And R is for raising taxes on tobacco for effective tobacco control. Implement Empower measures to reduce tobacco use and save lives. Unprecedented Empower progress shows that the battle against the tobacco epidemic is winnable. 1 in 10 deaths around the world is caused by tobacco smoke. Over the past decade, the percentage of world's population covered by at least one of the 6 Empower measures, a group of policies reduced to reduce tobacco use, grew from 15% to more than 60%. The good news, there are proven life-saving strategies to combat this global challenge, and the Empower tobacco control measures are at the top of the list. The progress that has been made worldwide and documented throughout this report shows that it is possible for the countries to turn the tide. WHO framework for tobacco control. The World Health Organization Framework Convention on Tobacco Control is the first international treaty negotiated under the auspices of World Health Organization. The objective is to protect present and future generations from the devastating health, social, environmental, and economic consequences of tobacco consumption and exposure to tobacco smoke. Tobacco dependence treatment. Treatment modalities include cold turkey, quitting smoking abruptly without the use of any nicotine replacement therapy or medication, prescription medications, bupropion and varenicline, nicotine replacement therapy, nicotine gum, patches, lozenges, inhalers, behavioral therapy, individual and group counseling, support groups, and practical advice. Recent updates. WHO fact sheets on psychoactive substance use. 2030 Agenda in Tobacco Control. The 2030 Agenda in Tobacco Control is included in the Sustainable Development Goal 3, which contains 13 targets covering health MGDs, emerging health priorities including non-communicable diseases, means of implementation including universal health coverage, framework convention on tobacco control. Target 3.3 aims to end the epidemics of HIV, TB, and malaria, and also includes neglected tropical diseases and other diseases of poverty, and health system strengthening through mainstream throughout. The two SDGs targets on tobacco control by target 3.4 by 2030 reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. Strengthen the implementation of World Health Organization Framework Convention on Tobacco Control in all countries as appropriate. Tobacco control is a development issue. $1.4 trillion in economic losses each year due to medical expensive and lost productive capacities, up to 5% of deforestation globally, and 4.5 trillion cigarette butts littered every year. The poor are more likely to smoke, increasing inequities and deepening poverty, and tobacco control intersects positively with 67 other targets. Smoking increases chances of midlife memory loss and confusion. Relation between smoking status and subjective cognitive decline in middle age and older adults, a cross-sectional analysis of 2019 behavioral risk factor surveillance system. So in the interest of time, we will skip to the MCQ section. MCQ number one, at a late night birthday party, some university friends are sitting in a cafe offering each other a puff. One of the friends at the occasion has never tried an electronic nicotine delivery system. Ends before. Of the following, a well known example of ends is A. Cigarette, B. Cigar, C. Water pipe, D. Vape, and E. Moist snuff.
D.
D.
Yes, the answer is D. A 55-year-old male patient presents to OPD complaining of difficulty swallowing and persistent chest pain. He has a history of heavy smoking for the past 15 years. The physician suspects the patient may have esophageal cancer. Of the following, the most likely etiological factor for patient's conditions might be A. Cigarette, B. Cigar, C. Hookah, D. Vape, and E. Moist snuff. So the answer is E. Moist snuff. Number three, a healthcare provider is counseling a patient with a known history of chain smoking on potential ways to quit. According to World Health Organization, one of the following not a recommended strategy for quitting smoking is A. Cold turkey, B. Nicotine replacement therapy, C. Prescription medication, D. Behavioral therapy, and E. Electronic nicotine delivery system.
E.
Yes, the answer is E. A 40-year-old patient has just quit smoking and is wondering about the benefits he can expect to see. According to the Centers for Disease Control and Prevention, after how long will the risk of coronary artery disease might drop close to someone who has never smoked? A 1 year, B 5 years, C 10 years, D 15 years, and E 20 years. So the answer is D. A pregnant woman is considering quitting smoking to improve the health of her unborn child. According to CDC, the potential benefit for her baby if she quits smoking during pregnancy is lower risk of sudden infant death syndrome, lower risk of Down syndrome, lower risk of chromosomal defects, lower risk of postpartum delivery, and lower risk of high birth weight.
A.
Yes, the answer is A, lower risk of sudden infant death syndrome. Number six, the WHO Framework Convention on Tobacco Control provides a strong concerted response to the global tobacco epidemic and its enormous health, social, environmental, and economic costs. Of the following, the only core demand reduction provision of WHO Framework Convention of Tobacco Control is A. Illicit trade in tobacco products, B. Sales to and by minors, C. Provision of support for alternative economically viable activities. D. Price tax measures to reduce the demand for tobacco. Any developing multi-sectoral tobacco control strategies. The answer is D. Price and tax measures to reduce the demand for tobacco. MCQ number 7. WHO has identified tobacco smoking as a significant contributor to NCDs and has set a goal to reduce the number of NCD deaths by 1/3 by 2030. The goal is in line with one of the following Sustainable Development Goals: A. SDG 1, B. SDG 2, C. SDG 3, D. SDG 4, and E. SDG 5.
C.
Yes, the answer is C. SDG 3. A country XYZ is implementing policies to reduce the prevalence of smoking and the related health risks in its population. The most unlikely action to be included in its strategy for smoking reduction may be A. Monitoring, B. Protecting, C. Warning, D. Encouraging, and E. Enforcing. The answer is E. Encouraging. City XYZ has already implemented several policies such as increasing taxes on cigarettes and creating smoke-free public spaces. The city council is now considering additional measures to further reduce smoking rates. Of the following, the most likely practice to achieve this goal may be A. Implement an advertising ban on for tobacco products, further raise taxes on smoking, C. Provide free nicotine replacement therapy to smokers who quit, D. Offer subsidies for electronic nicotine delivery systems, and E. Increase penalties for smoking in prohibited areas.
C.
Yes, the answer is C. WHO's unprecedented Empower progress shows that the battle against tobacco epidemic is winnable. Over the past decade, the percentage of world's population covered by at least one of the six Empower measures has reached up to A. 20%, B 40%, C 60%, D 80%, and E 100%. The answer is C 60%. This is the key of the MCQs. This is the link to our YouTube channel. Thank you very much.